Hello everyone, welcome to Motivation Medicose. My name is Pulkit Gupta, and in this video, we are going to start with the breast cancer. So it's a very important topic in fact pathology. So without wasting time, let's get started. So breast cancer, yes, it's the most common cancer in females. Basically, mainly it is common in the females in our country in India. Now let's see. First of all, the most a question come in your university exam. What are the risk factors of the breast cancer? So the first one and the main factor is the estrogen exposure. So estrogen exposure is the main cause of causing this breast cancer. Mainly 99%, as I've already told you, it is seen in the females. And basically, when it is seen when there's a early menarche or when there's a late menopause. At that time, mainly this is seen. And the second is the post-menopausal obesity. Basically, obesity, as you know, there's a adipose tissue deposition, which basically converts into estrogen, and that's why it's causing the breast cancer in the, you can say, in the postmenopausal females. And also, as you know, sometimes due to in case of hormone response therapy, there's a chances of increased estrogen level that causing the breast cancer, and also the endometrial cancer, which is responsible for this. After the second reason of causing risk factor for the breast cancer is the age. It is mainly seen in the postmenopausal. It is seen in the postmenopausal females, uh, this condition. And the third one is the in the radiation exposure in the chest region, basically in the above region, above the chest region. It is a region for causing the breast cancer. The fourth reason is the family history. If you have one in primary relative, in the one degree relative, if breast cancer is present, like if in a female, if her mother or her sister or her daughter is having the cancer, breast cancer, then it can be transferred. So primary relative, if there's a cancer. The next point is up in pregnancy. If there's a pregnancy, first pregnancy if occurred less than 20 years of age, then that's a good thing. That will decrease the risk. That will decrease the risk of breast cancer. But if the first pregnancy occur after 35 years of age, guys, then it is going to increase the risk of cancer, breast cancer. So this is about the pregnancy. The sixth point is the lactation. See, lactation is good one. It is a basically protective against the breast cancer. So basically, it what it do, it inhibits the ovulation and also the differentiation of cells. Basically, the metastasis occur. Uh, so not the metastasis, it's the metaplasia which occur, that is responsible for preventing from the breast cancer. And the last one is the dietary factors. So increased lipid and alcohol are also responsible for the increased risk of the breast cancer. Now let's see the pathogenesis. So basically, this breast cancer occur due to genetic factor as well as the environmental factor. Genetic factor, the main responsible for causing cancer is the tumor suppressor gene. This tumor suppressor gene is the villain of this aura of the breast cancer, which is causing the this breast cancer. So now let's see the pathogenesis. So it is basically of two type: familiar breast cancer and the sporadic. The most common, as you know, the sporadic breast cancer is seen in the 88% people, while familiar is seen in 12%, 10 to 12% only people. So sporadic one is most common. Let's see about them also. Now the first one is the familiar breast cancer. So as I have already told you, it is present 10 to 12%, and it is seen in early age of present. It is early age of in early age you can see this familiar breast cancer, and also multiple family members are involved. You can see the multiple family members will be involved in this case, and it is multifocal. Multifocal means there's a not one single cancer. There's a many small cancer will be present, that you can see. And now after this, the genes involved in causing the familiar breast cancer. So the first one is BRCA1 gene. Sorry, is a BRCA1 gene. Second is the BRCA2 gene. Third is P53, and the fourth is check gene, the check2 gene. So these four genes are involved in causing the breast cancer. So the BRCA1 gene, which is main in causing the familiar breast cancer, it is seen mainly in the females as compared to the male. And so you can remember this by ladies first. So one BRCA1, one malaf first is ladies. So females, it is more common in females breast cancer, and BRCA2 gene is more common in the males. So you can remember like that BRCA1 is common in female, ladies first, and BRCA2 in common in male. The third one, the P53 gene. This is the main culprit in the case of sporadic breast cancer. So this gene is common in the uh, you can say in the sporadic breast cancer, P53 gene. And the last one is the CHEK2 gene. This CHEK2 gene is seen in kidney, in the thyroid, or in the colon cancer. Due to the radiation exposure in these cancers, it may lead to the breast cancer. Now this BRCA1 gene, it is present on the 17th long arm of the chromosome, BRCA2 on the 13, and B53 on 17, and CHEK2 on 22. You can remember like 17, 13, 17, 22. Here are the four genes which are responsible for the breast cancers. Now this breast cancer in the BRCA1 gene also leads to the increase in chances of ovarian cancer. That's also known as serous cancer, and the breast cancer also known as basal-like cancer, or you can say medullary cancer. And the BRCA2 gene, which causing the more common cancer in the males, is also causing chances of prostate cancer, and that lead to a condition called Fanconi's anemia. That is due to the germline mutation of BRCA2 gene, basically due to that. And this P53 gene, this P53 gene is, as you know, it's most commonly seen in the sporadic breast cancer. It also leads to a condition called Leaf-Froning syndrome. This Leaf-Froning syndrome, which ultimately lead to sarcoma or leukemia, chances of them. After that, let's talk about the sporadic breast cancer, which is seen in mainly 88% of the people, and it mainly occurred due to the genetic factors. That is due to P53 gene or basically due to hormone exposure. There are two reasons. So mainly you can you have to remember that it is mainly due to P53 gene. P53 gene that's responsible for this sporadic breast cancer. Now these types of cancers. See, these are in general we talk about familiar and the sporadic. Familiar mainly about due to the genetic factors, and sporadic also mainly the genetic basically also leads to due to the hormone exposure. Now the types of cancer on the basis of the basement membrane involved and or not involved. So if basement membrane not involved, we are calling that cancer as carcinoma in situ. Carcinoma in situ. And if it is involved, then we are calling it infiltrating cancer or invasive. Invasive means, as you know, invasive cancer. You see, it is invading into the breast. That is causing the invading cancer. This carcinoma in situ are two types. That is ductal carcinoma and the lobular carcinoma in situ. While infiltrating carcinoma are divided in two bases, that is molecular classification and has histological classification. You have to remember that this molecular classification based on gene expression. Basically, we will do gene profiling, which will tell us the classification of the invasive cancer. While there is a histological classification, if there is a no special type of cancer, or there is a no special type of carcinoma, invasive carcinoma. So let's first talk about the carcinoma in situ. And in carcinoma in situ, we'll talk about the ductal carcinoma in situ first. So we are starting with the ductal, it's ductal carcinoma in situ. So ductal carcinoma, the first thing you know that basement membrane is not involved. Now what happened in this? There's a proliferation of the cells that leads to clonal proliferation occur, and that occur in the ducts. So, but in this case, this myoepithelial cell they remain preserved. They doesn't get damaged, but they remain preserved. But there's a clonal proliferation, and also the one this point is very important, that there's a necrosis and secretions which seen in this that may lead to calcification. So in this condition, this is the main thing, that there's a calcification you can see in ductal carcinoma in situ, which you can see in mammography. So you can identify in the mammography easily that there's a calcification, which indicate that this is a ductal carcinoma in situ. So 1%, this ductal carcinoma, if not treated, then it increase 1% per year. That will may lead to invasive carcinoma. How you can treat them? You can remove the breast, that is, you can do mastectomy, and also the radiation therapy, as well as you can give tamoxifen. Tamoxifen is an anti-estrogen drug. Basically, you know, the anti-estrogen level is one of the thing which is causing the breast. So for the we give these tamoxifen to prevent the reoccurrence, that if not again occur after the mastectomy. So that's why we give tamoxifen. Now this ductal carcinoma in situ are of two types, that is comedoductal carcinoma and non-comedo. Now, what is the difference in this? So, mainly the comedo one has high grade tumor cells present. You can see the T, this is tumor cells, high grade tumor cells, which you can see the calcification in them already because they are ductal carcinoma. There's a linear and the branching calcification seen, and there's a central necrosis. While not in non-ductal, you can see the pattern like cribriform pattern in which there's a tumor cell in between and there's a calcified area. Basically, you can see the tumor cells are basically they are shattered and the calcified areas in between. And the second thing is a micropapillary ductal carcinoma pattern. You can see there's one more which is not so common type of ductal carcinoma in situ. This is a Paget's disease of nipple. This is also one of the clinical case which comes in the exam. The Paget's disease of nipple. It's a type of, first of all, it's a type of ductal carcinoma in situ. Now, what happened in this case? So there's a pruritus occur. You can see there's a pruritus occur. Pruritus means there's a severe itching occur in the body, and which occurred due why it occurred due to ulceration of the nipple. There's a if you see around the nipple, there's a ulceration occur, and that may also have palpable mass, which may lead to invasive carcinoma in the future. Basically, there's a redness or edema around the breast region, so you can call it as enzymatous lesion. Exymatous, sorry, exymatous lesion. Now, basically, what happened in this? You can see this diagram. This is our breast region. Sorry, you can see this is our breast region. So this is our which this is the basement membrane, and this is our duct. So as you know, it's a carcinoma in situ, so it will not cross the basement membrane. So it will the tumor cells are only present through the duct, and it will reach the nipple, and it will basically causing the ulceration of the nipple and spreading to that region. And in case they may form palpable mass or invasive cancer and spreads, you can see in the region also. So this is the Paget set. Microscopically, you can see in your histology, you must have said that you see the Paget cells. Now, how they are seen, how this look, Paget cells look, they have mucin present, and also there's HER2 expression present. There's a abundant cytoplasm as well as a prominent nucleus you can see in your microscopically. The second type of carcinoma in situ is a lobular carcinoma in situ. Basically, in this there's a malignant cell which leads to discohesive nature of the cells. What happened in this? Basically, there's a gene mutation occur in this. There's a CDH1 gene. This gene, that is CDH1 gene, the mutation occur in this, and that may lead to decrease in cadherin. Now, what this cadherin, as name indicates, C cell adherin mean addition molecule, which helps in binding of these cell structures basically together. So if this structure is removed in between the cell, you can see there's one, two, three cells, and this structure in between is the cadherin. If this is removed, structure will be discohesive. So that's why calling it discohesive cells in this. There's a multifocal lesion in this also. You can see, but the one thing which differentiate the ductal carcinoma in situ and the lobular one is there's no, you can see this point, that is there's no secretion necrosis, there's no calcification then. So you cannot see in the mammography how this cancer can be identified. There's basically incidental finding occur, means you are testing for something else and you will able to find this cancer. So, but this can occur bilaterally, means on both the both the breast, this cancer occur. And in this also, if not treated 1% per year, it increase and may lead to invasive carcinoma.